Hello, everyone. My name is Didier Tranchier. I'm one of the two co-founders of Digital Pharma Lab based in Paris. I'm really happy to welcome you and that you participate to this wonderful webinar about Estonia. So I know that not everybody knows about Estonia. It's a small country. We're going to zoom in about this country, but it's very interesting country. I discovered Estonia about maybe 10 years ago because at that time it was probably the only country where there was no paper, and there was no paper not because they have no trees, but they decided to go full digital, and since then. Well, Estonia is probably one of the most advanced country, both in terms of digital spirit, creating startup. They have a density of unicorns by inhabitants that is the most dense in the world. And of course, we're going to zoom in about digital health because probably is also the leading country about digital health. So we have with us Jaanika Merilo, who is in charge of e-health strategy for the Estonian government, and Katrina, who is both an entrepreneur, CEO and founder of a company called Migration, who is working on migraine, but also she's a founding member of DTX Association in Estonia. So now that we have this just very brief introduction, let me give the floor to Jaanika, and maybe Jaanika, you can also present your country that once again I really admire, and I love to go there. And if you haven't been to Estonia, it's something that is missing in your life. You have at least to go to Estonia at least once in your life.
Yes, thank you for your kind invitation and great passion to Estonia. It's so nice to hear good things about Estonia. You know, one thing is when we tell that we're the best digital society, another thing is hearing it from you and someone else. So it's really nice to hear the good words. But truly, even according to different rankings like e-government development ranking and also digital decade and so on, we humbly are in the very top of the digital transformation and the e-services and e-developments. But today I would like to zoom in actually in e-health because during this e-health story, I will also tell you about the fundamentals of Estonian e-government as such that enables the whole society to operate really digitally. Because also the e-health is not a separate thing. It's a solution built in the government-wide infrastructure that enables everything to be digital. And actually, we do believe that we have all services digital besides getting married and getting divorced. But that was due to emotional reasons. Something has to be sacred, not because of technical reasons. And also, we have e-elections, which means I just voted a few days ago in European Parliament elections via my mobile phone. And the second thing that we can do digitally is voting for president. But again, we have a different system. Everything and anything else we believe we have digitally. That doesn't mean that it is digital only. It is definitely a democracy, which means that if someone insists on having the paper, you can also have these services offline. But it tends to be so complicated and takes so much time that you would prefer to go digital. So
yes,
we
Jaanika, sorry
incentivize it.
to interrupt you, but I think it's maybe good to tell where is Estonia, because I'm not sure that everybody knows where is Estonia, and I don't know if you're going to share maybe some figures about the population or about the history of Estonia, but I think it would be nice really to before we zoom in about innovation and digital health about your country.
Yes, well, I didn't prepare a map, but Estonia is a small country. We we're kidding that in the middle of the nowhere, not really. A small country, a member of EU and NATO since 2007, next to Finland and Latvia. So basically, we're bordering with Finland upper side, Russia, unfortunately, the right side, and then Latvia and Lithuania and Poland. So we're basically North Europe, Northeast Europe, let's say. But yes, we're a proud member of EU since already 20 years and part of the family, which means in regards to everything. And yes, Estonia, we speak Estonian. We have 1.3 million inhabitants, Estonians, and also quarter Russian speaking, but not depending on the age and nationality, everyone uses e-services. So what unites us is definitely the digital world and infrastructure and solutions. So we're a small country, and sometimes people say that yes, it's easier to implement the e-government in small country. But then again, when you're a small country, you have less resources also. Let's say when you have in Poland 600,000 IT specialists, we have 15,000. When you have like budgets in France for IT development, then again we have very, very tiny compared to France budget in Estonia for IT development. So kind of, yes, small country makes it possible to be this test lab and to be more agile. But then again, you have always limited resources in regards to people and availability of people and money and so on.
Maybe just, Jaanika, sorry to interrupt you again, but I think just to rephrase what you said, Estonia is one of the Baltic countries, is the one that is close to the Baltic Sea, and the language is close to the Finland, the Finnish language. And it used to be in history part of the Hanseatic League with a lot of merchants going through the Baltic Sea. And if I remember correctly, the country became independent in 1991. And since then, you created this wonderful digital infrastructure. And the capital city is Tallinn, for those who don't know, and the second city is Tartu.
Yes, and what is important, unfortunately, is that we were also part of the Soviet bloc for until 91. Why is it important? Because we believe that it actually kept us back in development a lot in regards to economics and IT and infrastructure and entrepreneurship and so on. So we basically started our path in 91, and our first policy or e-government, let's say, roadmap was launched in 94. So actually our starting point was from there. But then again, it gave us a good opportunity to rethink of how we want to build our government, our country, our infrastructure. And we decided that we shouldn't have a bureaucracy and corruption and then later fight with bureaucracy and corruption. We should have everything from day one digital, which means the computer connected to computer instead of person talking to civil servant and offering bribe or not. But so we actually decided on building the government-wide architecture since day one. And this was one of the wisest decision not to wait and later develop e-government, but to make it as an essential core part of the whole system and society. That means, of course, like the digital skills and overcoming the digital divide in the very first days, because if your government is e-government, that means that you have e-services, that means that people should be able to use them, should have an access to internet. And so we had very many different programs, including the Tiger Leap, when we already in 90s trained people or showed people how to use internet. We in just few years, we showed like 100,000 people together with telecoms and banks how to use the digital services. We launched over 1,000 of access points to internet in the early days when not everyone had internet at home. So it was like, let's say, digital mentality that started with our independence, and that has created a really good fundamental on which we can now build different e-healths and e-governments, and also very many IT companies and I believe startups benefit from having this digital society, which means that also our different IT companies have benefited from the government being the main procurer or the main client for the companies, so that they can also spin off and export their services that they develop together with government. And in Estonia, there is digital society.
I think, Jaanika, you wanted to share some slides just during when you are sharing the slides. So yes, we know a company like Skype some time ago. We know a company like Bolt and Taxify and many others. And there is many companies that have become global and that are unicorns. And Estonia was one of the first European country, in fact, to develop unicorns.
Yes, unfortunately, I would need a permission to share my slides. Sorry.
Okay, can you? And Katrina, maybe if you want to add something to Jaanika when we solve this small technical issue, don't hesitate.
I definitely won't hesitate. Jaanika has given a very good introduction to Estonia as a whole, and I very much appreciate how she did it. Also from the background on what makes us develop how we do, and what held us back in the past. So wish you very good luck for the presentation now, and let's kick off the webinar.
Okay,
Thank you.
sure. Thank you, Katrina. Jaanika, can you maybe put in the full screen mode?
Yes, it is actually in my full screen mode.
Okay, because what we see is not in full screen mode, so maybe you have the dual screen.
Let's try it differently. I will first put in full screen mode and then share. Sorry for the technical challenges.
No. That's part of the digital experience. Yes, now it works perfectly.
Okay, great. So maybe let's start from the past and then come to the future in regards to where we are in developing our e-health and e-solutions. So Estonia was actually first created an infrastructure on which you can build these solutions. And the infrastructure means that the access to e-government, all the databases and the principles. And then since 2007, we started actually building the e-health as such. And we made the e-health mandatory, which means that it wasn't like the doctors could continue hybrid life, that you have some papers and then you have computer. We decided to have everything digital since 2007, so that in the future the patients could see all their information online, and doctors could have an access to all the information about the patient. And to have this holistic view, you need to make it really mandatory, not an optional, because many countries are struggling with having a little bit paper, a little bit in databases, not really connecting the databases, and you don't have this like complete view. So since 2007, we started launching all the supporting solutions, let's say, which means in 2010, the digital prescription, which took off really fast. So basically, almost in a few months, we had a majority doctors prescribing the medicine through e-prescription, and people are really demanding e-prescriptions. So you wouldn't have to go to doctor again and wait for the paper and then take the paper, then remember to take it, go to pharmacy.
Yes, Jaanika, just to share about that. So you were saying about digital health started in 2007. So for those who don't remember, 2007, it was the beginning of the iPhone. So just a very long time ago. And you were already full digital and in that time. And e-prescription is going to happen, for example, in a country like France. It's planned to come here. but it's not there yet. So I mean, having e-prescription in 2010 is really, really advanced.
Yes, for us, it was like a really long time ago, because in 2019, we already started sharing the e-prescription cross-border with EU countries that have connected to the same infrastructure. And now we have the e-prescription exchange with 11 countries already in Europe. So basically, when the Polish doctor prescribes medicine for a Polish patient and he travels to Tallinn, he can buy it from the pharmacy in Tallinn. And for example, when the Finnish tourist unfortunately gets into accident somewhere in Poland, then the Polish doctor can see their patient summary, the main information that is needed to know. So we don't only like exchange the health information in the country, we also share it with the other countries, which is, I believe, the future vision for Europe as well,
Yes,
changing,
just
exchanging. Mhm.
Jaanika, just as an addition, I know that also Estonia and Tallinn in particular is a very touristic place. In particular, a lot of Finnish people like to cross the Baltic Sea to come here. So of course, having this exchange and with other country and sharing digital patient data is once again something that is really, really advanced.
Yes, exactly. And we have exchanged e-prescription over 30,000 times. That means that people who are traveling abroad or working in Estonia or Finland, our neighboring country, could really buy this medicine in pharmacy in Estonia instead of waiting in line to doctor in Estonia, getting the same prescription and so on. So it really like makes the change when you have this exchange with your neighboring country, especially. Because so many people work abroad and so on. I don't want to take too much time, but I still want very much to show you our e-health system, because it is the fundamental to everything, and our e-health portal that all the citizens see. But basically the core fundamental of our system is ID card, which means that all of the people are required or expected to have an ID card, which is a key or access to all of your data, not only health data, but also to a citizen register and to your education portal, to any information that government knows about you. And which is nice in Estonia, it is a once only principle. So
Yes,
once
maybe
government...
Jaanika, sorry, but I saw that you were talking about e-resident. So I'm one of the e-resident. I have my e-resident identity card, which means for those who don't know that anybody in the world can have an e-resident card in Estonia and having access to many digital services. And one of the main digital services is you can create a company in a fully digital company based in Estonia, which is also my case, by the way. And I can share my experience that I was really impressed. I mean, you can create a company in a few hours. Everything is digital. And the fact is that you have just one ID, because the social security number is also your identity card number. So I mean, it's so obvious, it's so simple, but of course it's how you can create something really, really useful.
And why would you want to have a e-residence also is that Estonian taxation is really simple. It's the simplest taxation actually in EU and one of the simplest in the world. In regards to, we don't have a corporate tax, which means that as long as you keep reinvesting money, you don't have a corporate tax, which is like a real benefit for the companies to grow, to invest, as well as the ease of paying taxes and doing the business. We're one of the front runners again in the ease of doing business, because if you have everything digital, it takes you basically a minute to fill in the tax report, for example. I, as a private citizen, have to file the tax report annually, but it takes me really 2 or 3 minutes because government has all the information about me. And yes, someone might say that it might be scary that government knows everything about you, but then again, we really do have the high trust towards the government because it is transparent, meaning that if I'm sharing my data with the government or with different IT systems or registries, I have also a control over who uses my data how. Because in my portal, I will show you later, I have also the log about who accessed my data, who had the right to access, why they accessed my data. So it's also transparency from the government that I'm in control of my own data. Plus, I can close something, I can open something, I can choose what to show whom, and so on. So, yes, welcome to Estonia and to become a e-resident. It's really nice to run business in Estonia, and Katrina definitely knows about it and can share later what is the benefit of being Estonian startup. But one of the, again, main principles is the principle of once only, that if any government institution or government service knows some information, another service or another government institution cannot ask it again, because all the registers have to be connected, and I have provided it. Please ask from the different institution. And the backbone of our system is this exchange between registries, and it's really like seamless exchange. This is why I can file my tax report in few minutes, because it's all interconnected through my ID code and my identification.
Yes, maybe also one remark about what you're saying, because that's also in France, we like to have a central database. We think that having all data in the same place is going to be simple and useful. And I know that in Estonia, even if you're, let's say, quite a small country, it's a distributed organization of data, which I think is very, very smart, because of course you can have the flexibility of having multiple database, and also, of course, all these databases are also interconnected, and it's at the same time simple, and of course it protects the anonymity of data and the access of data. So I don't know if you have any remark about how, why you created this decentralized infrastructure, but I think it's one of the key points, and probably I would say that most countries should, of course, look at your architecture and probably replicate what you've done.
Yes, indeed. We have many different registries, and they are connected through this X road. But then again, in eHealth, for example, we have one central registry, but still we get data from very many different systems. It's not like everyone enters the information in one big database. We are interoperating or actually exchanging the information with many different systems. It's all about like creating the standards and the means of identification of the person and the processes, and then you can connect as many databases as you need. But yes, we don't believe in one giant government database because of very many different reasons of security, of uptime, of different data holders, and so on.
Maybe,
But,
Jaanika, if you can
yes.
share maybe, yes, sorry, about how you can control your own patient data, that would
Exactly. So I wanted to welcome you to our patient portal. And the patient portal is basically interface on how the patients and also the doctors can see the information of someone. So this is the front door, and this central portal, or we call it health portal, actually gathers and shows you all the information that any medical worker can see, all the possible doctor appointments, the diagnostics, the lab results, the medical images, the vaccinations, anything that has been done in any doctor, in a government funded doctor or a public doctor, or as well as private doctors, which means that basically, even if you go to a private clinic, they still have to enter the medical information to the central database, because then the other doctor can see it as well and make more wise decision based on seeing the holistic picture of the patient. So here, for example, you can see what are my next appointments to the doctors, what are my subscribed medicine, what medicine I haven't dispensed or bought already, and we have as well the timeline on my recent appointments. I can open the appointment and see any medical images, any x-rays, any lab results. But what is important, I can also hide my information. Because, for example, I might permit my mother to see my medical information just in case, or my husband, or I can see my underage child's medical information. But for example, I don't want my mother to see that I visited some doctors or that I have some specific diagnosis. So I can also opt out, which means close my patient data so that some doctors wouldn't see that, don't need to know that, or my representatives or relatives wouldn't see because they don't need to know that I have also right for privacy. So this is very important, and this is one of the principles that European health data space also dictates the new act, that everyone should be in control also of their own privacy, that needs to know basis, that yes, my treating doctor needs to know, but my dentist wouldn't need to know that I might have mental issues, for example. And yes, even the private doctors up to dentists have to enter their information and medical images to the same portal or database. And no, definitely vaccinations, but here you can see the log file. So basically anyone that sees or looks at my medical information leaves a track. So, for example, my general practitioner or my family doctor has a right to access my data. So, by definition, she has a permission to access it. But, for example, if she accessed my data on a Sunday, I haven't been to an appointment, I'm not going to an appointment, this might arise a question that, despite of having permission, why did she look at my data? What was the basis for that? So here in the log file, I can see anyone, everyone that have reviewed my data. And this gives me, again, a control of my private data, because now I can basically ask the next question. Why, based on what, have seen my private data? Because when you go to a doctor and you have this reception and the files somewhere around, you don't have a control who really looked at your file or didn't. But here you leave this electronic footprint of everything that you do and that someone else does. So what the future brings, definitely we're excited about the cross-border services in regards to exchanging the e-prescription and health data with other countries. And we share a patient summary with France. For example, when a French tourist or visitor that we hope after this election will visit Estonia will, unfortunately, we hope not, have to visit doctor for any reason, then they can show their patient summary, the main information, to a doctor in Estonia. So that the doctor wouldn't, for example, have to run the allergy tests again to prescribe the allergy medicine, for example, or anything that might be beneficial, and you don't have to print it out and bring it with you. And as well, we very much believe in, I won't go into standards, but in the new technology, which means the benefiting all the new solutions like AI and so on for the sake of something. Like we don't so much believe innovation for the sake of innovation, but for example, we very much believe that AI can help us with lack of medical personnel, because some of the functions can be in a good way outsourced, or in regards to analyzing the big sets of data, in regards to finding the new patterns, new medicine, the research. The next stage of development is definitely sharing as much as possible anonymized health data with any researcher company that would need it to develop the new personalized medicine and personalized approach. Because having this huge pool of data, the genomic data, the health data, it should be also to benefit future research, future innovation. So this is just the basics that we have created. Now we have to start building on it. Thank you.
Well, thank you very much, Jaanika. And for those who are attending this webinar, you can ask some question. There is a special page where you can ask some question, and we will have a question and answer session at the end of the presentation. So Jaanika, maybe to reformulate what you said, of course, the patient data is in full control of the patient. The patient can have every patient data on its portal. It can have, it can share, not share. There is a full privacy of the data, and also there is a full interoperability between all institution, healthcare institution. And of course, this is the basis of many innovation in Estonia. And what we're saying is that even for French people willing to go to Estonia and visit Tallinn and visit Tallinn Castle, they can have they can be taken in charge with the Estonian healthcare system. So let's go to Tallinn. So thank you very much. Now that we see the infrastructure, the full digital, which I think is very wonderful compared, especially to the French system. We don't have a full digital prescription. We don't have full control of our patient data for the moment. But now there is the other part, which the fact that Estonia is seen as the startup nation with a lot of unicorns, a lot of digital startup, and of course, digital health is one of the most advanced domains. So I want to ask maybe Katrina to maybe present what's the situation in Estonia with digital health. And maybe present, of course, your startup company, of course.
So very happy to. I will share a few slides also, but as the first thing, very thankful for Jaanika for the great introduction into Estonian healthcare, e-health and healthcare system, and what we have built in past 20-30 years, and how strategic these developments actually have been, and how the developments that have been made by the country and the government actually enable new developments by the private sector. And as Jaanika said, the doors are open for other companies from other countries, also France, to come and test here in Estonia. So I hope I reflected you well in that sense. I'm now sharing my slides. I hope you see them well. You can nod if you do.
Yes. Okay. Yes. Great.
So, as Didier introduced me before, I'm Katrina Laks, CEO and co-founder of MyGrevention, but also a board member of Health Founders and part of DTX Estonia. And as I very much love to introduce myself is the fact that you have to, in Estonia, to do something, you have to build a village with one hand, and the house that is the company with another. So that very much reflects what I do on a daily basis. I start with the same thing that Jaanika actually introduced in more words. X-Road is something that enables everything in Estonia. I won't stay here for a lot of time, but I really want to stress the importance of the development that has been made and that enables current and future developments that are done now. But the basis of Estonian health, e-health, on top of X-Road are definitely the digital health data decisions that were made wisely 20 years ago. E-prescriptions, e-ambulance, and also the biobank with 200,000 gene donors in there. Jaanika was very modest in talking about that, but we launched last week the data to gene donors themselves, the first batch of data, and that enables another batch of new developments towards personalized medicine in pharmacogenomic, digital health, e-health field. And I think that Estonia as a whole, as a country, and Estonian private companies also have taken the focus towards personalized medicine, being it in digital health, more towards IVDR or other fields. We are going more personalized, more preventive than sick care, and what I really appreciate is the fact how private sector and government work together for a common goal. Just to mark up the 4 pillars of Estonian health innovation that have popped out for us as the main ones. The social insurance tax that enables us to actually do something, state responsibility for insurance coverage, decentralized provider network, private operators actually that are governed mostly by public entities, and a very strong primary care network. Universal free access for every citizen who has a family doctor, and that makes a lot of outpatient contacts done by them, not by secondary healthcare. So more and more healthcare is done on the primary level and very well. But how Estonia, from the private sector view, is taking healthcare onto next level. Some things were actually very well mentioned by Jaanika before. New data exchange platform, not documents, but data. And we're very much wanting to take the data into harmonized field, not into different silos. And that's a huge work to do, not only in Estonia, but EU and world as a whole. Central treatment plans that Estonian healthcare providers are working on. So if I who I am today in Tartu, Didier, you introduced the second largest city in Estonia very well, the university city. If I go here to a healthcare provider, my doctor in Tallinn sees it very well, and they work together, not separately. And the data is my data, my own data is actually in one place. And our goal is for better structured, timely, and easy to find data, and that applies to healthcare companies coming up also, that we are not creating anything that will take that data somewhere else that's not meaningful, but we are all giving our data also into the pool. A new health portal for the patient was recently launched. We had a very good personalized medicine project recently. Research and development, innovation and entrepreneurship activation roadmap was launched, and digital health by digital therapeutics is a focus area. Applied research grants are provided for companies to develop new solutions and to do clinical studies also. And additionally, not mentioned here, Estonian Health Insurance Fund is actually supporting impact studies for the solutions who already are ready for taking into use on a national level. And governmentally, the support for the growth of digital health ecosystem has always been there, and is now there in year by year. I have been in the ecosystem for a little over 4 years on a stronger level. The activation has been done by past 5 years, although the digital health ecosystem is a lot older. Connected Health Cluster and Tartu Biotechnology Park were there before. We started 5 years ago. DTX Estonia digital therapeutics are very new as whole, but DTX Estonia was born in 2022, and not in Estonia, but in Estonian pavilion, Estonian ground in Dubai at Dubai Expo. So we have a great place to remember that. And we recently launched Health Founders Estonia Consortia, very strong consortia between Tartu University Hospital, Tartu Science Park, Civita Health Founders, and DTX Estonia to bring Estonian health ecosystem to another level. From the DTX perspective and the DTX Estonia development map, the first companies actually started more than 10 years ago. So there have been like these waves of companies coming. 2013, Dermtest did their first developments. Triumph Health and Co-Nurse followed in 2017, 2018. Then there was a pause, and 2020, Microvention and Activate Health, now named as LifeCare, were born. And Dermtest now is developing their GTX solution, and SpeakTX was born in 2022. Past 2 years for the whole world for the DTX development have been tough. So in Estonia also, no new digital therapeutics have been born in past 2 years, but the ones who are alive and kicking. And Estonian digital therapeutic ecosystem is very open for getting the new solutions in to help them grow, test, and get their things going from Estonia.
Yes, maybe Katrina,
yeah.
yes, a question, because probably, as you know, now DTX are reimbursed in Germany. Now they're also reimbursed in France. So what is the business model of digital therapeutics in Estonia?
So currently in Estonia, no digital therapeutics is reimbursed by the National Health Insurance Fund. There is no DTX reimbursement per se, but they are openly working towards that health insurance fund business model also. And Dermtest, as the first one, is in the preliminary listing. But Microvention is reimbursed by Estonian private insurance funds. So we have different opportunities. We are not there yet that we have the DIGA or PICAN as you do in France or DIGA in Germany. But we are working towards the public DTX reimbursement system also, and maybe Jaanika can also elaborate there from the governmental view.
Yes, from the governmental view, we needed to implement it in our procedures so that it would be a really, let's say, priority and vital service which to procure from the private sector. We're now working on our new e-health strategy, and the aim of it is to enable people to stay at home longer so that they can not go to some care home, but to spend their last years at home, which means we need very many different innovative solutions to support this. And for that, we need to in a good way, invent new models of how to engage the different service providers so that they would be part of the treatment plan and of the social care plan as well. And now we're working on actually integrating the social and healthcare services so that they would be like not a one flow, but one lifespan and support each other, that you don't have separately social care and health care, but for example, so that the person would stay home at longer and wouldn't have certain diseases because you can prevent it by using different devices and consultations. So it needs to be part of the support process in both social and healthcare. So now we're working on integrating it to one holistic picture and including the, if we want people to stay at home, they need this kind of tools. Where can we get these tools and how can we compensate those tools? So yes, this is this year's plan to integrate it into one big picture so that it will be supported as one of the priority areas in healthcare as well.
Great, thank you.
Thank you, Jaanika, for the elaboration. And as Jaanika very nicely elaborated, DTXs and similar solutions as a whole are widely meant for prevention and supporting people at home. So that's where we actually want to give our 5 cents to the pathway. But microvention is one of the solutions that DTX Estonia represents. I'm very proudly the co-founder and CEO of the company, and we started around 4 years ago, and we mapped the fact that the market of primary headaches, where microvention by name also is aimed at, is very fragmented, and the solutions are usually either meant for the patients or the healthcare providers, but nothing is meant for covering the pathway as a whole. And as a company co-founded by Dr. Mark Prashinsky, a renowned neurologist from Tartu University Hospital, and patients as me and others, we actually covered the full pathway from the patients feeling the headaches initially and going through the full healthcare pathway. And we are more towards prevention. The current intended purpose for the patient headache application is a prevention of medication overuse, and it's a clinically validated digital headache diary, and we are able to mirror the health data to the healthcare provider patient manager dashboard to better monitor and manage the patients in healthcare system. But we're working on the digital therapeutic models, and they're in clinical studies currently here in Tartu. So very happy that you included me to the webinar. Very happy that I could be here with the governmental side also. I think that Estonia works together to promote the opportunities here, both in public and private sector. And if anyone has any questions, ready to answer them now, but also in the futures.
Yes, so thank you very much, Katrina. In fact, we have a few questions. The first question is about treating the data from multiple sources, hospital, biobanks. Do you have a data federation infrastructure that allows researchers to perform analysis and run queries on different patient data? So I think it's for both of you, and probably
yep, I can take the short and easy answer from the startup point of view or the private point of view, and there are two options, basically to collect the data yourself or go for the secondary health data. on the secondary health data field. Jaanika showed before the options of how and which kind of data layers are actually available. And the easy answer is that the access to data is available. The pathway could be easier, but Jaanika could elaborate that also.
Yes, well, we have very much data available since 2007. The first challenge is that we are trying to make it maximum available in a structured form, not to have just any data, but actually to have this high quality and rich data. Then the second issue that we're solving now is how to make the data available from different sources so that it wouldn't be sent out as data. Here are the Excel sheets of data, but we're in the final stage of procuring the secure processing platform where you can actually request the data, put the data, and run all the modeling or whatever is needed with this data. So I think Finland has figured it out quite well with their Kapsula FinData. And first step would be, we hope starting from the beginning of next year to have this one secure environment where we can put different data sources. And then as a next step, to have this one secure environment where you can request the data not only from healthcare providers, but also, for example, from population register or education databases, or you can combine also different sources of data, which is really important. That is not only healthcare, because if you, for example, want to understand what are the risk factors for developing breast cancer, probably you would need to have more than health data. Maybe the environment data, maybe you need some educational background or so on. So our next step for probably the next year, it's not only depending on us, is to have this wider availability of data, not only healthcare. We see this as very important next step, as well as social data, of course.
Okay, so there is a second question directly linked to that, is about personalized medicine, because I think it's for both of you. Since you have all the personal data, you can, of course, analyze the patient pathway. You can have the holistic view about what's happening for every patient. And of course, it's probably the first step about personalized medicine. Do you have maybe example, or maybe what are the most advanced experience in terms of personalized medicine?
Jaanika, would you like to start?
Yes, well, we are now starting to really, in a good way, use this wide range of data that we have, meaning to combine different sets of data, because the data is not valuable if you have it separately. We're running the first pilots on combining the genomic data as well as your health data. And for example, we will be rolling out now the first breast cancer risk scoring, because now we call to cancer risk test any age group. Let's say this year we call all the women that were born in this year. And this is not really efficient, not for everyone, because maybe your probability is not so high, and it is not efficient for the government to run and test on the population or a patient group that is not under a great risk. So now we're starting to profile different diseases, starting from the breast cancer, that who has the higher probability based on their genomic data combined with the patient summary and diagnosis and so on. So we do have different kind of still personalized approach solutions, which is decision support, for example, for the doctors, that the system basically scans through your health record and recommends what medicine to prescribe, what next test to run, and so on. So, but I would say we're still starting to, in a good way, utilize and combine this data together, and starting from the giving back information to the patient on their risk scores and on their, for example, how well the different drugs are observed by a patient, absorbed, and so on. So, for example, we're also running a pilot on different alternatives on painkillers, because it is the most common drug the people are using. So some painkillers might work better with certain also genotype, but also your microorganisms. Certain drugs might work less. So basically, this is also one example of personalized medicine, that really medicine which works, which doesn't. But we're really piloting this solution to further roll it out in upcoming years when we had the first algorithms in place. It is always the hardest part to get the algorithm, not data.
Thank you, Jaanika. I'm sure, Katrina, you have some example maybe from your own company.
I definitely have a few examples, but as I'm in Tartu, I think one of the good things is to bring out the biobank project that was just launched, and I talked about it earlier also. And the initial feedback from the 200,000 gene donors, I think, was that in the first few days, 50,000 of them logged into this new my biobank portal and looked at the very personalized data about them, about their pharmacogenomic data, very limited, but still, and also some data about second type of diabetes and cardiovascular diseases. So I think that's one very good thing about Microvention's view to the data, is that we have been the primary data collector since the very beginning. And in the future, in the very near future, our data will be available for others, for health insurance fund, but also other interested entities in Estonia. Just as Jaanika said, for understanding and prevention of use, for example, ill using of painkillers, because it's very easily foreseeable from the data what works and what not. So why to use it?
Thank you, Katrina. I see that the time is running and we have only a few minutes to conclude. So maybe just to try to wrap up what we discuss is the fact that in Estonia there is this digital infrastructure with all this data that is digitalized in different database and access that are in, there is the interconnection between all these database. And which means that now with this infrastructure, we have a lot of digital therapeutics startup, but also digital health startups that are taking advantage of that, especially the biobank, and of course the fact that we can have access to all the data, the patient data, and going to personalized therapies. What I would like I would have many other questions, but just for the people that are attending, we are organizing in the future some learning expedition in Estonia, because both in Tallinn and in Tartu, because we know that the two cities are very important in terms of innovation. But I think that we should have addressed also Gen AI about how, of course, you can share the fact that there is a lack of healthcare professionals, and how, of course, digital innovation can be a very good solution for this topic. But unfortunately, we don't have time. So, of course, if you have any more question, let's contact us. And of course, if you want to see more, or if you want to go to Tallinn and Tartu and in Estonia, please feel free to contact us. Thank you very much, Jaanika. Thank you very much, Katrina. I'm sure we'll have some opportunities to meet in the future. And have a good day. Have a good day to you and for all the people who have attended this webinar. Thank you.
And please come to ask all the questions in Tallinn in person. It always works better. Welcome.
Okay. Thank you very much. Bye.
Thank you so much.